Good morning. My name is Garrett Sheehan, President and CEO of the Greater New Haven Chamber of Commerce and Quinnipiac Chamber of Commerce. Thank you so much for joining our 18th Annual Regional Healthcare and Life Sciences Virtual Awards Program. We will start in just a moment. We want to make sure we give everyone an opportunity to log into the program now. So we'll get started in just a couple of moments.
Get my fucking email on here right now.
Yeah.
I think, hey, Peter, I think your audio is on. If you can just turn that, we'll have you come on live in just a couple of minutes.
You good?
No. I'm gonna try to get it.
The first one. Join the browser. Okay. Turn off the phone, otherwise you get feedback.
Peter, please mute your line.
Good morning, everyone. I know people are now able to join us. Apologize, there was some issue with one of the settings as for people to be able to log in, but I can see people are now able to log in. So we'll just give everyone a couple more minutes to get into the program, and we will get started in just a couple of minutes. Thank you so much for bearing with us. Again, good morning, everyone. My name is Garrett Sheehan. I am President and CEO of the Greater New Haven Chamber of Commerce. I realize we had a slight technical difficulty in the login link this morning, but hopefully that has been solved. I see everyone getting into the program now. We'll give everyone just one more minute and then we'll get started. Appreciate your patience. Good morning. My name is Garrett Sheehan, and I am President and CEO of the Greater New Haven Chamber of Commerce. And we want to welcome you to the 18th Annual Regional Healthcare and Life Sciences Virtual Awards Program. As I said, this is our 18th year putting together this program, but today is obviously much different from the previous 17. Back at the start of the year, we thought this would be a day where we would be gathering at the Alexion building to celebrate the strength of our healthcare and life science industries. Instead, we're all distancing and recovering from the devastating effects of the virus. While we're not here together, we're still able to celebrate businesses, people, and organizations in healthcare and life sciences. Now, before we begin, I want to acknowledge just the devastating effect this virus has had, the human toll of it all. And we want to take a moment of silence to recognize all of the victims of COVID-19. And also, as we discuss social injustice and George Floyd, we want to recognize all of the victims from racial injustice. Please pause with me for a moment of silence. Thank you. I want to thank our entire chamber team for their assistance in putting together this program for you this morning. It's a new format for everyone, and as you saw, if you had trouble getting in this morning, there are challenges with putting it together, and we work through those. Our goal is to keep it interesting and informative. In a moment, we'll hear from Marna Borgstrom. Then we will welcome in our panel to discuss COVID-19 and how our local businesses have responded, and also the economic growth of our region. We'll take your questions and then move into our awards, and we'll hear from people at each of these organizations. We'll have a brief discussion with our council leadership, announce this year's Chamber Wellness Challenge winners, and wrap it up with a grand prize drawing. So please stick around. You must be online to win that prize. Before we get started, I do want to take a moment just to thank all of the businesses that have supported the Chamber through this time. Especially our investors. These are the companies and organizations that are on these slides that have made a long-term investment in the Chamber, and it has allowed us to continue to be operational during this time. We are here today because of our Healthcare and Life Science Council. I want to thank all of our members of the Council and Mirtha Kalina for their longtime sponsorship of the Council. For our program today, a big thanks to News 8 WTNH, our presenting sponsor, our award sponsor, Retreat Behavioral Health, our event sponsors, Alexion, AMR, and BioCT, our wellness sponsor, Harvard Pilgrim Healthcare, and then of course our media sponsors, IKEA, New Haven Register, New Haven Biz, and News 8. Now I did mention we will have a grand prize coming up in just a little bit, so please stick around for the grand prize giveaway that will be awarded at the end of the program. As you can see on here, there are lots of great prizes. The theme is Eat Local, Shop Local, Play Local. And before we get started with that, I just want to say we have so many of our businesses across the region who have spent so much time putting effort into cleanliness, making sure that their restaurants are safe, that their stores are safe for both their customers and employees. And so we really want to encourage everyone to be able to go out and visit these businesses. And that's why we wanted to recognize these particular businesses in our award and our gift grand prize today. So thank you again to them, and we will have this at the end of the program. Now it's my pleasure to welcome Marna Borgstrom, the President and CEO of Yale New Haven Health. And obviously the hospital has been on the front lines of the COVID fight, and we appreciate Marna giving us the welcome this morning.
Good morning, everyone. I'm Marna Borgstrom, CEO of Yale New Haven Health, and I want to welcome you to this morning's virtual Healthcare and Life Sciences Award celebration. This is the 18th annual event, although it feels quite a bit different than the previous 17 ceremonies given the impact of COVID-19. However, we're still very proud to take part in this event, which I understand has drawn more than 200 online participants. Over the last 4 months, our hospital and health system have cared for thousands of COVID-positive patients and have discharged more than 3,000 people safely from our health system. The efforts of our frontline staff and employees have been truly inspiring, and I've been personally humbled by their dedication and commitment to fight this challenge head-on. And as a direct result, we are making enormous progress. As I tape this message, hospitalizations at Yale New Haven have dropped from a peak of nearly 450 to under 70. And while our work is not over, the tides have certainly turned in our favor. Today you will hear from a panel of experts that include Commissioner David Lehman and Dr. Albert Ko, both of whom have been intricately involved in the state's response to this pandemic. You will also hear from George Lotto from Alexion and Todd Arnold from Sema4, 2 companies on the forefront of bioscience revolution here in New Haven. On behalf of Yale New Haven, I want to say also how grateful we are to be receiving this year's Chamber Award for Outstanding Wellness Program. As we continue to battle the challenges embedded in the COVID crisis, the need for programs that promote emotional balance and wellness have never been more important. I'm also proud that our very own Andy Orefici has been appointed to serve as the new chair of the Chamber's Healthcare and Life Sciences Council. I am confident that you will be well served by Andy's experience in the community. So thank you for your attendance today, and I look forward to joining you again, hopefully in person, at the Chamber's annual meeting on October 8th. In the meantime, I offer my very best wishes for a successful event.
Marna, thank you so much for providing that welcome, and we are excited to get going with our panel discussion. So I'll ask our panelists to turn on their cameras. Our panel today is our growing sectors, how healthcare and life sciences are defining Greater New Haven and responding to COVID-19. We're going to have a discussion here. We'll also try to take in maybe some of your questions if we can, so you can put those into the chat if you have questions. We'll try to get to those at the end. And I also want to make sure that we get through and introduce all of our panelists. So we have Todd Arnold, Chief Laboratory Operations Officer at Sema4, David Lehman, the Commissioner of the Connecticut Department of Economic and Community Development, and also the Governor's Senior Economic Advisor, Dr. Albert Ko, Chair at the Department of Epidemiology of Microbial Diseases at the Yale School of Public Health, George Lotto, Senior Vice President and Chief Information Officer of Alexion, and Erica Smith, CEO at RENEX Bio Incorporated. Thank you all for joining us. We appreciate you taking the time to be with us this morning. And Dr. Ko, if you're out there, please turn on your camera, because I wanted to ask you actually the first question. You have been following this virus as we've gone throughout. Can you just tell us, where are we? I think our understanding of the virus has changed so much over the last several months. It's continually rapidly evolves, and even where we are in defeating the virus right now.
Well, thank you, Garrett, and also thank you to the members of the Chamber of Commerce for the kind invitation. It's a real honor to be here with colleagues, also people like Marna Borgstrom, who's actually my employer. Being an employee of Yale New Haven Health, it's a real pleasure and a privilege to be talking to you. So where are we right now? So I think, you know, because of really the strong policies and the early implementation of strong social distancing by the governor and the governor's office, you know, we've really mitigated, you know, a very large and potentially devastating epidemic. So we're now down on the curve. Marna was talking previously about, you know, how we protected our healthcare systems and our populations. We were up to about 2,000 hospitalizations or people hospitalized at the peak of the epidemic. Now we're less than 200 hospitalizations, you know, in the state. So that's all good news. I think the big question is what the future will hold for us. And as we see what's played out in the West Coast and states in the South, such as Texas and Arizona, this proves kind of the foundational principles that this is a highly transmissible virus. In Connecticut, you know, although we had a large epidemic, only a small proportion of people were exposed. So we are, you know, at risk, and we will have a resurgence. We don't know where that will happen and when that will happen, or how much or how big that resurgence is. So we have to avoid a situation of complacency. And I think that makes it ever more critical, ever more urgent that members of this Chamber of Commerce, together with people in government, together with our, you know, academic institutions, research institutions, people like, you know, Charles Lee, the director of Jackson Laboratory, who stepped up in the early stages of the epidemic to support, you know, the government and the state, that we band together to really work to do put the work in now, whether it's, you know, with vaccines, doing vaccine trials or monoclonal antibody trials, expanding our testing capacity, introducing new innovation to our testing so it's cost effective and more efficient. We need to prepare that, not just for the next half year or the next 3 months, but actually right now.
Thank you, Dr. Ko. And George, I'll turn to you. I know Alexion actually has been working on a therapeutic to deal with COVID-19. And you and I always joke, we like to make sure that people know that Alexion is still here and thriving in New Haven. But having these collaborations, having so many biotech companies right here in this region, in this state, is definitely helping our fight against COVID.
Yeah, no, thanks, Garrett. And as Dr. Cole mentioned, thanks for having me. I thank the membership as well. It's fantastic being here, and I feel like you're all in our building. Even though it's virtual, you're supposed to be in our building. We're all in the auditorium. That's what I see in my mind. So thank you. Thank you so much for having me. Alexion is honored to be part of this. Yeah, we announced in late April, Garrett, that we have we started a clinical trial, a controlled clinical trial for a treatment given one of our therapies and our products. And it's a controlled study that we initially staffed it or looked to get at least 270 patients in the controlled trial. And we're hoping to get data sometime in mid to late July. And the treatment is largely for severe pneumonia and acute respiratory distress syndrome. So when patients contract the virus and they go through their stages, they'll end up in the hospital and perhaps on a mechanical ventilator. What our product does is it inhibits the terminal complement system and hopefully suppresses any injury to the lung and inflammation that may cause any fatalities. So we're very hopeful that the data in July is going to be positive and that we'll have a treatment for patients going forward.
Erica, thank you for joining us as well. And along with running ReNetX, you've been involved in the biotech industry for quite a long time. You've been on many sides of it, venture capital. When you look at New Haven and this region overall, do we have the ingredients that it takes to continue to grow the sector here?
I mean, absolutely. New Haven and Connecticut really has amazing superstars that, can be leveraged here. Actually, I just came from BIO, so the Bio Innovation Organization's annual trade meeting last week. And typically, I'm on the board there, and there's about 1,000 biotech companies that are represented both internationally as well as nationally as part of that organization. And unfortunately, of course, because of COVID, everything was paused, and they had to run the meeting virtually, where 30,000 people would typically come together in San Diego. It was all held digitally. But the theme was nothing stops innovation. And I think that's sort of a watchword of our industry. And I think Connecticut really represents that. And there were some facts that were shared as part of that larger international meeting that I think that, some of the things that we punch above our weight really from a organization and from a state perspective. For example, just to give you a couple fun facts, is Connecticut was 4th in the country per capita, all this is per capita, on bioscience related patents, on venture capital, and 3rd in venture capital investment, and 3rd in academic and bioscience R&D expenditure. So I think there's not any argument that we have superstars here in Connecticut, Biohaven, Arvinas, Trevi Therapeutics, which are all in New Haven, and a company give a little shout out for our own company, Renetics Bio, as well. So I think we're very poised, and having Yale as a cornerstone, and the support we have with Connecticut Innovations, we're have the potential to do very big things here.
And Todd, I know you feel the same way, but it's not just New Haven, it's the entire region to the state as well. But you're located out in Branford, and you guys continue to expand there.
That's true. Yeah, Garrett, thanks for the opportunity to join this morning. And it's nice to see my colleagues even virtually. I was hoping to sit down with you, but we'll take this. And I will vouch for it's safe to visit the local businesses, because I got a haircut last week. I didn't do so great this morning, but it was much longer before and was threatening a man bun, but decided I would go with it. But at any rate, it is safe to go out and get your haircut. So please support the local businesses. So yeah, it's true, Garrett. I've been in Connecticut since 2000, and I did the reverse commute. I came down from Boston as opposed to exiting the state to go and pursue opportunities elsewhere. And I think the exciting thing about what we're doing here in the greater New Haven area is the growth that you're seeing. I mean, there have been a number of new companies that have come into Branford recently. I've called Branford home for my biotech and bioscience career since 2007, when I worked with 454 Life Sciences. And Semaphore is also a reverse commute company. We spun out from Mount Sinai, but we started our work here in April of 2014 as the Mount Sinai Genetic Testing Lab here in Branford, Connecticut, with 3 of us who are all 454 alumni. We now have over 80 people located in the Branford site that I'm sitting in right at the moment. We've also taken over another site in Branford to manage our COVID testing expansion that we've been very active with, and working with Yale and Jackson and others here in the state to provide the testing for the state of Connecticut for COVID. I'm very passionate about the growth of bioscience in Connecticut, and definitely passionate about the way that it's growing in the state, both in the New Haven area along the shoreline and statewide. But I agree with Erica's comments. It is an exciting place to be, and definitely is got both oars in the water, so to speak, in terms of the pace that we're getting with our bioscience and the investment in the capital we have here, and the wonderful science that's happening here overall.
Thank you, Todd. And David, as I hear everyone speaking, it sounds like we have lots of businesses that are ready to expand. How can Connecticut capitalize on that? Obviously, given where we are, we're in a tremendous economic downturn right now, but this is an industry where there's opportunity. Also, even we know the Neuroscience Center that Yale New Haven Health is planning. Yep. And moving forward with 101 College Street.
Yep. Yeah, no, and listen, those are 4 tough acts to follow. So first off, I appreciate you having me on, but your question about the ecosystem that we have, you're really centered around the New Haven area. I think it is significant, and I think it's one of our biggest opportunities. I felt that way pre-COVID, and I feel even more conviction about it now. And we could talk maybe a bit more about 101 College and what Winstanley's intending to do there. But when we looked at the data, what we found is you have this tremendous patent generation and IP coming out of the state, and primarily the New Haven area, driven by Yale, but you have it elsewhere as well. And what we as a state have done poorly empirically is commercialize it. We've created these ideas, these ideas that can make money, but then they've been exported, unfortunately. So I think what we need to do, and this really gets to why I think 101 College is probably one of the most important and transformational projects, is we need to work on creating that ecosystem where you can have, the center of gravity, if you will, in one place physically. And then I think ultimately you're going to see more likely people staying here, people coming here, and you're ultimately going to see what you saw in a Cambridge, or what you're seeing in San Diego and certain parts of the bio universe, where you're going to have a hub and spoke type model where the rest of the state will certainly be participating, but I think the New Haven area will be that center. So I think what we need to do is we need to concentrate our efforts in terms of where the state can recruitment, financial incentives perspective, to make sure that we get to that critical mass point where we're no longer exporting our best ideas, but we're rather importing people.
And David, while you're talking here, I'm going to launch a poll just about people's opinions of growth in the greater New Haven region. But David, let me ask you this as well, because you've been doing so much with the reopen and the state's response to dealing with the virus. I know you've worked with several of these companies, whether it's on testing, some of the therapeutics that are coming down the line, obviously working with Dr. Ko and the great researchers that we have in the state. Has that helped our response as a state in COVID?
Well, I think I may have been the only person on the reopen committee with only a bachelor's degree. So I kind of stood in the corner and took notes when Dr. Ko was talking, is what my role was. But no, seriously, what Yale has done, Todd was mentioning Sema4, Alexion's here, Jackson Labs. We have such great companies that have stepped up. They've worked with the state hand in hand, and this is away from the hospital system, which has been working so collaboratively. So it's been really great to see in this crisis. One of the benefits is you've seen this tremendous coordination and collaboration, and I think the firepower that we have in-house has been really, really helpful. And I think it's been one of the key reasons, candidly, why the response that the state has been so productive, and you've seen the data be so strong.
Okay, I'm going to post the results here, and they're pretty strong as well. So 92% said yes, so that's really positive, especially given everything that is going on right now. Dr. Ko, in science, and especially right now with the virus, we see how collaborative science is to try to address these issues. So having all of these companies, these researchers here in New Haven, does it really make a difference for the scientific process and also for growing a cluster?
Yeah, so I think that's an important question. It's an important strategic question in the sense that critical mass is a key issue. When we think about knowledge exchange or knowledge pipelines, and having that also spread out, across different disciplines, for example, clinical research, product development, basic science or basic biomedical research, that type of incubator, phenomenon is an important characteristic. So certainly this is coming together with COVID, with companies in the region, but also nationally, working because of the public health emergency, working collaboratively in harmonizing protocols, harmonizing process development, sharing, intellectual property in ways that we never would envision, in the future. I think a good example of this is really the collaboration. I think the model for Connecticut is the collaboration that was stood up by the governor's office, particularly Josh Javel, Michelle Gilman, also with David, in getting Jackson Laboratories, Sema4, Yale New Haven Hospital working together, and in actually sharing protocols, helping each one of themselves getting their EUA or emergency use, authorizations for their testing, so that the state can, create its own homegrown infrastructure for large mass scale testing. So it's that type of collaboration that's really come out, and that kind of spirit that's come out of this public health emergency. Surely this was an unfortunate, devastating, for many of us, a devastating, event in our lives. But I think if we come out of this and really take out some of the ground principles of what brought us together and how we work together, I think that's a model for both private as well as private-public partnerships.
Todd, I'm going to start with you on this question, but anyone can jump in as well. You and I talked about the workforce pipeline and how critical that is to continue to grow the industry, that there are people here who are able to fill the positions, that we're able to bring in people as well who can take on some of these roles. Todd.
I'm sorry, Gary, that's not for me.
Todd, yep.
I don't know. Todd, there we go.
There we go. It's better when others can hear me. Yeah, I think it's definitely, in terms of talent, one of the things that we pride ourselves on, certainly at the Branford site, was we have probably close to 90% of our hires are Connecticut-based folks. So that gives a really strong testimonial to the quality of the educational systems and the training programs that exist in the state, for one. Secondarily, we're able to recruit from all parts of our country. So Connecticut is now becoming a destination basically because of the quality of the science and what's happening in the state in terms of bioscience growth and the way that we're getting it out there. And Erica referred to things at Bio. I think those of you who've been at Bio recently and have been to the Connecticut display out there, it is definitely top notch, and you get a lot of visibility there. So I think the state is really getting some traction in terms of attracting talent. I mean, the proximity to Yale, the interactions that we have with colleges and universities within the state. I think it's an attractive place to be. I think there's a lot to offer for folks here. There is now starting to be enough critical mass for bioscience companies that folks can not only, if you have a spouse or significant other that's also in the science area, there are jobs that can be found for couples. So I think I'm very excited about that. I look at things that happen with Southern Connecticut State University with the BioPath program and things like that. I think we're really growing the opportunities internally and focusing on the students who stay in the state, and also, we're the best recruiters for folks to come to the state in terms of recruitment.
And I'll just jump in to add, because I would echo those comments completely. I think the piece that differentiates Connecticut when you travel to Boston or New York or some of the mega centers is that the community that gets developed here, the connections. I mean, Renetics is a perfect example. The technology started at Yale. I worked at Yale, took that out. We're still in New Haven. We can walk to our founder's office if needed. And actually, that really initiates and has the ability to, leverage new innovation coming from academia. And I'll also add, BioCT has been a huge driving force in bringing industry and universities and all sorts of individuals together. And in fact, I want to say the last public event I was at was at the BioCT Mixer. I think it was like the beginning of March. We didn't know what was ahead for us. But, in that meeting, I mean, everybody, it's such a community. People know one another, want to help each other. And, for the talent perspective, if one is looking for someone, if we have this center of gravity for Connecticut where, if one company is successful and another one comes in, and, you don't have this, if something doesn't work out, what do I do? There is such a center of gravity here in Connecticut, specifically certainly in Branford and New Haven. There's such an amazing opportunity to leverage where we are today.
I would just say we're very fortunate on behalf of the governor. Erica actually serves and represents the industry on the governor's workforce council. So, this has been one of the core sectors that we've decided to focus on to really make sure that we have the talent here and that we're attracting the talent here to stay here.
Hey Garrett, if I could riff on some of this.
Yeah, go ahead, George.
Yeah, no, I know we're talking a bit about sciences and innovation. I'd like to really approach innovation just generally and talk about that and how I think in New Haven and Connecticut, we could really push that forward. And the example I want to use is every February, I go to Silicon Valley. And so that tells you something. I have to get on a plane and go to Silicon Valley. And so 5 years ago, I found this precious company called Zoom. right? Technology we're using today. No one knew of Zoom back then. Zoom is now Kleenex, it's Xerox, right? It's Purell. And Eric and his team, there were 3 people and a dog in a garage, right? Wanting to beat Microsoft and Cisco at this video collaboration. And it was innovation at its best, given where he came from, and he was an immigrant as well. And that's what I think we need to create. When I hear David talk about 101, and what we're trying to do in the state and just in New Haven from an innovation perspective, I don't want to get in a plane. I don't even want to get in a car, right? And I want to have the best of innovation, science, technology, or otherwise, right in our city. And we're building, right? But the question is, how do we now attract the best and the brightest, right? And capture that IP.
George, we were also talking about, we obviously are all talking a lot about racial injustice, but in the biotech industry, how do we diversify the workforce? How do we bring more people in to be able to work? And New Haven's an urban center. How do we reach the students throughout New Haven and the entire region and get them interested, and then also get the skills they need and the education they need to be able to take advantage of these jobs?
Yeah, yeah. Thanks, Garrett, and thank you. Thank you for the opening. First of all, for recognizing, right? I mean, it's been horrific, right? Where the country's been going and the potential future, and hopefully we can stop and change some of that. But my feeling on that, Garrett, is we have to not talk about it and actually get out there. And I in the last couple of years, I've been working on not the collegiate level, not the high school level, but I've been going after guidance counselors and intermediate. And so if you can influence counselors and parents, they influence the younger children that want to be in our fields. And so I focused at that level specifically with STEM. And a number of weeks ago, I don't know if anyone saw it, but one of my mentors, Ken Frazier, was on CNBC and did a fantastic job talking about how Merck is taking a number of youth. They're making them show up at 9 a.m. They're making them dress a certain way. And by the way, this is what he did when he was inner city youth in Philadelphia. And he's taking these children, he's helping to train them in STEM. And then when they're old enough, they get an internship. They get a 6-month internship at the company. And you could pass or fail. And as he said, they're not going to be the head of my research, but they're going to be in my company and they're going to have an opportunity. I think that's what all of us have to create, right? Let's not talk about it. Let's get out there. Let's create those opportunities like Ken had. And by the way, like I had, and then let it flourish. And so I think from a bio perspective, we have such an opportunity to introduce kids to such cool and unique science, engineering, technology, et cetera, that will just turn them on to a world that they've never seen before. And like me, when I was a 7th grader, when I first started programming, I just fell in love with it week 1. And so that's what we have to introduce. And when we talk about things like the digital divide in this country, companies like us, we can help fund that, right? Locally, regionally, right, or internationally.
And anyone else who wants to jump in, I know Erica, we talked about this as well, about how we can get more people into the pipeline for these jobs.
I mean, I don't think there's a more important call to action at this point in time. I mean, just flat out, straight up. And I think anything that can be done at the local level, the regional level, the national level, international level, that we need to do. One of the groups, as I mentioned, BIO is, sort of the trade organization that's representing all of these companies, had started a number of years ago something called the Workforce Diversity Initiative. And it's called the Right Mix Matters. So basically trying to increase the talent pipeline, increase leadership diversity at the board level, and so on and so forth. The good news is that there's been some movement in that. It's already started, but they've just brought on a new CEO, Dr. Michelle McMurray-Heath, who is an extraordinary woman and is really driving this. So not only to, of course, the talent pipeline and making sure that we have leadership, but the COVID crisis has brought out the health disparity in underserved populations, and that's disproportionate. and should not be happening. There's also an opportunity for the biotech industry to support diversity in clinical trials. This is something that really hasn't happened. So there is, I'm so proud that that organization is taking a step forward, and obviously companies at an individual level will do the same. But I would highly encourage anyone that has even a few minutes to watch the webinar that was put on for BIO called Speaking Up and Out on Equality, Diversity, and Inclusion. It had some of the leading Black CEOs in biotechnology companies speaking about where we've been and where we could go. And I think everybody is aware of what sort of the disparity, and hopefully we can come up with solutions to address it.
Great. And I see someone asked if we can post that link, so we can definitely do that. And actually, Erica, if you don't mind just throwing that in the chat box if you have that, or we can also send it out to everyone who attended as well. We're going to wrap up in just a moment. Any other comments about this industry, about growth, or any of the topics that we covered this morning from our panelists that you want to touch on before we finish? And again, I do really want to thank everyone for being a part of this. Well, David, let me ask you one last question as we're finishing up. And I should say Mike Piscatelli from the City of New Haven texted me and want to make sure that I mention this. And it is true that with the 101 College Street building, part of the developer agreement, there are a lot of clauses in there that really are going to support making that an open building for the entire community and getting more people involved and really touching youth throughout New Haven, but also creating it as an opportunity for others. David, any comments on that? And then also, we are just another day away from the next phase of reopening, which I know you've spent hours, days, weekends on putting together, and it's been going well so far. And so just any last comments on that?
Yeah, just quickly, I don't want to overstay my welcome here. So on 101 College, and I think I used the word transformational before, and I really believe that 500,000 square feet. Winstanley is clearly committed to New Haven. He's committed to the project. And as you mentioned, and Mike put the bug in your ear, it was really important given the state and ultimately what will be the city's support of the project, that it is inclusive. And that's not just, the construction of it, the management of it, but making sure that there are events there that benefit the entirety of the community to make sure we're lifting everyone up and providing opportunities to everyone. And again, we just think that's really important. Winstanley agrees, and we're hopeful that this will have a profound impact on New Haven alongside the new Yale Neuroscience Center when that resumes. So I think that will be a really important project, and we hope to have more details on that soon, but everything's on track there. In terms of the reopening, tomorrow, June 17th is phase 2, and that is our biggest phase. The vast majority of the economy that's not open will be able to open. We anticipate it happening slowly though, and that's just what we've seen. And that's not just with businesses, but the consumer is getting ready and more ready to come back. But consumer confidence and consumer preferences are really going to dictate this. And when we had phase 1, not everyone rushed to that retail store or that outdoor restaurant, and we expect to see the same here. But I think it's really important. Connecticut has some of the best numbers in terms of positivity and transmission in the nation. Obviously, we should all touch wood, but I think a lot of that is candidly the vigilance and compliance around the mitigation measures in place. So, we want to make sure in phase 2, people continue to wear masks. That's a really important mitigant. Hand hygiene, whether it's sanitizer or washing, needs to be done religiously. And the physical distancing is really important. I was traveling this past weekend to another state, I won't mention it, and there was a lack of compliance, and it was surprising to me. So as we reopen the economy, we want to do that, but it's important that we continue to embrace these mitigation measures to make sure that the spread remains under control. But we're going to be watching it to see if there is increased transmission in early to mid-July before we enter our third and final phase. So all things so good so far, but it's really important that we continue to have that real fervor around compliance. And the last thing I would say is in our second phase, just to make sure it's clear, we are still advising work from home where folks can do that, and folks that are 65 and older should continue to stay safe, stay home, as well as folks with comorbidity. So that hasn't changed. We are definitely not at the all clear, and we need to remain vigilant.
David, thank you.
How'd I do, Albert?
George, Erica, Albert, Todd, thank you so much for being a part of the panel this morning. A really great conversation, and as all of our attendees attested to, we're excited about the opportunities not only here in New Haven, the region, and also the state. So we appreciate you all being a part of the program. Thank you.
Thanks, Garrett.
Thanks for having us,
Thank you,
Garrett.
Garrett.
Great to be here.
Thank you. Take care, Dave.
Bye-bye.
We still have more to go. You might have seen Jonathan Rothberg pop on there. We'll get to him in just a moment. First, I want to introduce Peter Shore, who is the CEO of Retreat Behavioral Health, our award sponsor, to get us going with the awards. And Peter, if you could turn on your camera right now, and we'll bring you up to get us kicked off here on the awards program. We appreciate Retreat Behavioral Health being a part of this program. And Peter, if you can hear me there.
I hear you, Garrett. I'm just waiting for you to be able to start my video. It says you.
Okay, I'll start. If you want to just say a couple words about Retreat Behavioral Health, and then I'll start the video as soon as you wrap up.
Okay. I'm talking about my video. I can't get on my
Your
link.
video. Sorry. These are the things that we work through.
I know.
We will get your video on there. If let me change to this panel, so I'll work on that. And there you go. I think that should work.
There you go.
All right. Sorry about that.
That's all right. It's all right. Well, thank you, Garrett. Good morning, everyone. We are Retreat Behavioral Health, a new member of the community. We're a national company, but we came to New Haven and opened in February of this year, right before the pandemic started. We are a facility that treats substance use disorder and mental health disorders. We've been open through all of this crisis and have seen a big spike and unfortunately in people using and abusing because of the uncertainty of what's going on. We are a proud member of the New Haven community now, and we want to be a good neighbor. We want to help our community and be a resource for our community. We have seen, in the short period of time that we're open, hundreds of people have come through our doors already. We see the pandemic as being something that's going to be a long-term effect, especially on mental health disorders. And we want people to know that we're there to help. Now to get on with the program and talk about today, it's something that's kind of special for us to be part of this. We're very proud to be a sponsor of the 2020 Healthcare and Life Sciences Awards. This, as Garrett said earlier, is the 18 years of the Chamber recognizing organizations making a significant impact in the region. I'm sure no one thought this year would be on a Zoom conference how they do the awards, and a lot of awards throughout the country are getting done like this. It's a new way we do business, but it's some way to stay connected, and it's something that we're proud to be part of. The 6 honorees are organizations that have really stepped up to be helped during this pandemic and very deserving of the awards that they'll be receiving. Again, we're very proud to be a sponsor. And if you want to read about the individual organizations, it's in your digital program. Right now, Garrett's going to run a video on each organization. But again, thank you very much. And thank you, Garrett, and thank you to the Chamber for including us in this event. And we're very proud to be part of it.
Thank you, Peter.
With everything going on, we thought this was a perfect timing to be able to recognize all of the healthcare and life science businesses that have responded so much to the COVID crisis.
Organizations like Yale New Haven Health's Employee and Family Resources Program, winner of the Wellbeing Wellness Award for supporting healthcare heroes.
There's been a whole child care initiative. There's been help for grocery shopping and things like that. We do webinars on mindfulness and resilience and stress.
The Manufacturing Award is being given to Biomed Devices, based in Guilford.
We've been making ventilators since 1973. Now all of a sudden, everyone knows what a ventilator is. So we're excited to be recognized, especially with all the hard work our employees have been putting in.
Another Guilford company, Homo Deus Inc., is being recognized with the BioLife Sciences Award.
We're developing a home test for COVID-19. We're being honored for going for something at the scale of ambition that can be such a game changer. for the testing space.
The Healthcare Clinical Award goes to Cornell Scott Hill Health Center's Grant Street Partnership Program, part of the Addiction Treatment Division.
I think that we've been really forward thinking and we're able to quickly adapt to the changing landscape of healthcare, particularly with COVID-19.
The Nonprofit Program Award is being given to Continuum of Care, which runs residential and crisis programs for those with mental illness or developmental disabilities.
The first basic life need that we had to worry about was making sure that everybody's was fed and safe. We're actually really grateful that we were able to respond and react to this crisis as easily as we did.
Lastly, the recipient of the Research Company Award is the Jackson Laboratory, doing mouse genetics in Maine for more than 90 years.
Our colleagues there have actually been developing and producing mice that are being used for testing new vaccines for COVID-19 in the area of providing the testing on a large scale to the state of Connecticut.
In an uncertain time, the awards are a chance to recognize the good right here in our midst.
After the pandemic occurred, it was amazing to see how they could respond, and that's a great asset to have for Connecticut. With everything going.
And I want to thank News 8 and Sarah Cody for putting that together, the entire team. We really appreciate it. And what you're looking at right now is the actual trophy that all of our honorees will be receiving. At this point, I'd like to bring in Jonathan Rothberg, Homo Deus. His company, our first company to recognize for outstanding biotech company. And Jonathan, thank you so much for joining us. We've heard about this take-home test that your company has been working on. Tell us more about it.
Great, and thanks. Before I do, though, I do want to give you guys some breaking news.
Great.
I'm involved in another New Haven company, AI Therapeutics, which was founded by Yale researcher Qian Shu and myself, and is being directed by Dr. Ganel, who is the chairman of neurosurgery at Yale. And for those of you who have done drug development, we just got one of our most exciting letters from the FDA, and it's called You May Proceed letter. And what that means is we have permission to start a drug trial for COVID-19 at Yale and across the United States as a early therapeutic. This is super exciting to us. When the outbreak started in January, we rushed our drug to Wuhan and tested it in first cells and showed it was effective for stopping the entry of the SARS-CoV-2 virus, the virus that causes COVID-19, into cells. We then submitted our data to the FDA, and while we were waiting to hear back from the FDA, a group at Harvard and a group sponsored by the Gates Foundation tested 13,000 compounds, basically every drug anybody's ever used or anything that's ever been safe in man or other suspected drugs, 13,000 drugs. And apilimumab, AI Therapeutics LAM-2, was the #1 drug out of 13,000 tested. And so with that additional information provided to the FDA, we literally just got the green light and we'll be starting trials in humans, in man, at Yale and other institutions. And we're all keeping our fingers crossed that this drug stops entry of the virus and prevents the devastating effects we've all seen. We're
That's
also
incredible.
excited
Really exciting.
to expand
Thank you.
that afterwards to a prophylactic. Now, I do want to though talk about COVID. Sorry for monopolizing because I know you have other people, but I do have to say Butterfly has also now shipped 10,000 ultrasounds that are being used for COVID lung. But what I'm here to do today is do a COVID test that you could do at home. We are mass producing a test now. We hope to have FDA approval in the next 6 weeks. And this is a low-cost $10 device. We provide a swab, and live for the first time, I'm going to do the test on myself. You simply swab, put it in the outside of your nose. You don't have to stick it way up there.
And we've heard so many of the tests are invasive. You have
A
to go all the
single
way up.
tube.
That's very minimal.
Yep, you just wash it in the tube. You put a cap on, that's it. The cap has all the test reagents. So what we've done is taken that clinical laboratory, that's the gold standard with all those machines, and put it in a magic tablet, literally, through our molecular biology. You close the cap, you shake, and we have a low-cost $20 device that's a base station that you plug it in. 20 minutes later, you put the sample into the reader and you read your COVID status. Now, if you didn't do your collection correct, it will tell you. So there's a line that says you collected your sample correctly, and there's another line that says whether you have COVID. This can all be done at home. We're not FDA approved yet. We have tested it at labs at UPenn, and we're testing at Yale. In the next 6 weeks, we'll hopefully have approval, but we are mass producing these now. We couldn't wait. In the same way that we couldn't wait for the FDA to say we could start trials to make drugs, we actually have been fabricating material for our AI therapeutics for 5 million doses.
Wow.
In the same way, we've been gearing up manufacturing, so we'll be able to provide literally millions of tests a month within the next 60 to 90 days once we have FDA approval. So I thank everybody for the award, but what I want to make clear is all of this is made possible by the teams. The AI Therapeutics has an amazing team, and Dr. Gunnell, chairman of neurosurgery at Yale, is really the one that made that happen. The Butterfly team has gotten 10,000 devices out there scanning for COVID lungs, and the Homodeus team in the last 90 days has gone from 0 to a 60-person team. They went out and raised independent capital, and they're now mass producing the world's first nucleic acid home test. This isn't an antibody test that comes 10 days later, or a rapid antigen test like a flu, which has a lot of false negatives. This is the gold standard laboratory test for molecular biology now brought to your home. So a little bit of an advertisement, but thank you.
That's great. Jonathan, thank you so much. And I think you heard a little bit of our panel talking about this region, life science companies. You have so many great companies that are doing great things. Why do you choose to locate all of them here? You could be anywhere in the world.
Wow, that's a good point. I'm in Connecticut because people forget that Connecticut really is a powerhouse in terms of a military, industrial, and telecommunication space. And what we've done is we've brought technology to biology. And it's that base that has worked so well. And of course, the school systems. We are able to move people, and since Curagen and our 454 Life Sciences, we've moved over 500 families to Connecticut. And the number one reason they come to Connecticut is those school systems that their young children can go to. So great education, great school systems, and of course, now a real biomedical cluster.
Dr. Jonathan Rothberg, thank you so much. We're excited about all the progress that you're making for COVID. Thank you. Let me now welcome in Dana Murphy, who is accepting for the Grant Street Partnership at Cornell Scott Hill Health Center. It's our outstanding clinical program. And Dana, your team worked under incredible pressures to keep this program going through COVID.
Hi, good morning. Exciting news, but a tough act to follow. I would just like to say on behalf of the Grant Street Partnership Program and the Cornell Scott Hill Health Center, it's an honor and privilege to accept this award. Today is bittersweet, as none of us could have imagined 3 months ago the incredible challenges we would be faced with. Today, we dedicate this award to Curtis Hunt, our colleague who we tragically lost at the onset of the pandemic. Curtis was just one of the many unsung heroes that have been lost. During times of tragedy, we sometimes see the worst, but often the best of humanity. I am incredibly proud of all the staff at Grant Street, the Behavioral Health Division, and all of Cornell Scott Hill Health Center, who, in spite of their grief, fear, and anxiety, show up every day, putting the needs of those we serve first. Now more than ever, we continue our commitment to providing the care, life-saving supports, and services for not just our clients, but the community at large. For many of us, the work we do is not just a job, but a mission. We believe in the power of recovery and hold hope that even in times of darkness and despair, we will continue to see a bright new future. So on behalf of Grant Street and Cornell Scott Hill Health Center, thank you very much for this award.
Thank you, Dana. We're going to play a very brief video, and we appreciate all of the work that you and your colleagues have done.
So at Grant Street Partnership Program, we provide integrated holistic day treatment for addiction, including PHP, partial hospitalization, IOP, and outpatient services. In addition, we offer outpatient mental health services to adults, men and women in the greater New Haven area. What makes Grant Street particularly unique is that in addition to our traditional services, we offer a 44-bed therapeutic shelter for men attached to treatment in order to provide them with a safe therapeutic environment to recover. In terms of holistic treatment, we offer AccuDetox, mindful yoga, primary care, and infectious disease. We're also looking forward to our new home, the Recovery and Wellness Center, which will also include an additional 12 beds for female and further expansion of clinical services.
Let me welcome in our next honoree, the Jackson Laboratory, and representing the Jackson Laboratories is Dr. Charles Lee, their scientific director. Dr. Lee, thank you so much for joining us this morning. And the Jackson Laboratories has been addressing COVID on many fronts, not only testing, but also in your research.
Yes, thank you, Garrett. The Jackson Laboratory is really humbled to be accepting this award on. Thanks to the Greater New Haven Chamber of Commerce for this honor and for making the effort to appreciate all the nominees, each of them doing impressive work to benefit Connecticut. I want to just take a moment to thank Rose Ponte from the town of Farmington, Cindy Bombard from the Central Connecticut Chamber of Commerce, and Rebecca Nolan from Metro Hartford Alliance for nominating us for this award. We really greatly value our partnership with the state of Connecticut and the surrounding communities, and are committed to doing our part during this pandemic crisis and beyond. And indeed, we're really pleased to be working, as I said, with the state. The Reopen Connecticut Task Force, so aptly chaired by Albert Coe, who you just heard from, and Indra Nui, our colleagues at Yale and our colleagues at Semaphore and elsewhere to be providing the COVID-19 testing to the state. And in a broader sense, we're really pleased to be providing mice to researchers all over the world that are studying COVID-19 and developing vaccines. JAX is continuing in these ways to support its mission for discovering precise genomic solutions for human diseases while supporting the critical work of others. So again, on behalf of all of us here at the Jackson Laboratory, thank you so much for this honor.
Dr. Lee, thank you as well. And I should mention, since the Jackson Laboratory has been here in Connecticut, they've been members of the Greater New Haven Chamber of Commerce, I think speaking to that collaboration for the statewide biotech efforts. So appreciate your support of the Chamber as well. Let me now bring in Continuum of Care. Let's welcome in Patty Walker. She is the CEO of Continuum of Care, this year's recipient of the Outstanding Nonprofit in the Face of COVID-19. And Patty, thank you for joining us. And you're muted, Patty. We'll get your unmuted there.
Okay, got it?
We got it, thank you.
Okay,
Thank you so much, Garrett, and we thank you so much for this wonderful award. It means a great deal to us. You know, most people don't realize that if you are running community-based services, that you are still essential care. You're not a hospital, you're not an inpatient unit, but you're still an essential care worker, because the very vulnerable people that we service in our group homes, in our crisis intervention programs, in our substance abuse programs, we have programs for individuals with autism and mental illness, and many of them who are afflicted with multiple comorbidities. And so we are essential care workers. And so we're very grateful for this award. And we are very grateful particularly to our staff, who really had to shine and did during this pandemic. I mean, whoever thought we would ever have been here where we are. And we have hundreds and hundreds of clients across the state of Connecticut and 44 residential programs. And our staff really stepped up to the plate, and we owe them a great sense of gratitude. So I'm very happy to have the public opportunity to say thank you to the staff of Continuum of Care. We actually had some staff volunteer to work 5 days straight, as in shut in, sleep 24/7 for an entire week in one of our residential programs to assure the safety and well-being of our clients. And so we are very grateful for that. We are also very grateful to the community at large that embraced our need for PPE. We had many churches and social groups making masks by the hundreds. Many of our staff made masks by the hundreds. And the PPE companies, who were very quick to respond to us, because they didn't realize that, you know, group homes and community-based workers were essential care providers. And they really came to our aid in getting us the important masks and gloves and things that we needed for our folks. So we were very happy to be able to keep our staff and our clients safe. And it wasn't an easy easy to do with the COVID being what it is. So I thank you again for this wonderful award. And we do have a video as well that probably explains a lot better than I do. But thank you so much to the Chambers for this wonderful award.
And thank you, Patty. And let me play that video. Watching the video, I should just mention our nonprofits across the state really were facing with a dire situation. So much resources, rightfully so, going to hospitals, the nonprofits were in very difficult positions, and just like we see so many stepped up and responded to the moment. So all of those other nonprofits that did so much during this time. Appreciate your support, Patty and the Chamber. Again to Continuum of Care. Let's now move on to our Well-Being and Wellness Award, and that this year is going to Yale New Haven Health, and joining us is Bud Wassel, who is the coordinator of their outstanding wellness program for health of their employees and family resources. Bud, thank you so much for joining us. Medical professionals are trained to deal with difficult situations, but this was something that they have never seen before, so rapid, so devastating, having to play so many roles, even as a family member for many of the patients, and putting their own lives in danger. How was your program able to support the employees at Yale New Haven Health?
Yeah, thank you, Garrett. And let me just say thank you also to the Chamber for this award. We really, really appreciate it. we did a number of things that we had, many of them already in place, but we amplified so many of them since the beginning of March. And so on behalf of Employee and Family Resources and Yale New Haven Health, we are very honored to receive this recognition. Employee and Family Resources is our employee assistance and work life program for employees and family members of the health system. So we already serve our 28,000 employees across the state. And over the years, we've been very proactive in offering a variety of services: counseling, work life resource and referral for childcare, elder care. But we also expanded into mindfulness training, stress and resilience services to our employees because of just the natural stresses just being in healthcare before this even hit. And so our program was already kind of an internal, natural focus for employee well-being. And I do want to point out we have an external provider, Beacon Health Options, who supports and provides direct services to our employees. I'm the internal manager of the program. And I want to call out a couple of individuals, two of my colleagues, Vivian Burgle and Tom Leutner, who've really been instrumental in providing direct services to our employees for the past few years and during this time. Very, very talented, dedicated professionals. And so I want to thank them personally for their assistance and their being alongside, being my partner in all this. But the thing that's really interesting is, our Employee and Family Resources program is really just the tip of the iceberg. When COVID-19 hit, we had an overwhelming amount of internal support from leadership, right from human resources leadership, right up to our senior human resources, senior VP Kevin Myatt, and my boss Jody Boldraghini. There's always been tremendous support, which is really quite unusual for these kinds of services. So we had laid that foundation prior to this. But then there were other internal resources: social work, spiritual care, nursing, medical staff, other human resource departments, diversity and inclusion, internal marketing and communications, our training and development office, the Institute for Excellence. And they all rallied around. We were all worried about our frontline employees. So we quickly formed a multidisciplinary team across the system, a very high-performing, creative team of individuals. I think at one point we had up to 50 people on this team. And we came up with some great ideas. We did things like, first we created a unique COVID wellness page on our intranet. So you had one place where you could go and find all the internal resources. And that was half the battle, just making sure that people knew about them. We created a buddy system so that we really encouraged every employee to pick a colleague as a buddy to check in with about wellness and emotional well-being during this time. We set up Oasis quiet rooms and across the system, so frontline staff had a place to go to decompress, even if it was just for a couple of minutes, just to take a mindful moment or to just take a breather or even just take a moment to cry. And this was all done by this healthcare support team. So we were just really part of that effort. And I was really proud to be part of that overall team, So it's really that team that, has demonstrated the commitment to care and compassion and support for our employees on the front lines, who they're the ones that really, of course, sacrifice daily to ensure compassionate, high quality patient care during the most stressful time really in our history, extremely high stress 3 months during this past spring during the COVID-19 pandemic. So really on behalf of all of us, I want to thank you for this recognition and thank you so much.
Thank you, Bud. And like you said, really an incredible effort. And then what your team was able to do to support the medical professionals. We all appreciate it. I now want to welcome in Dean Bennett, who is accepting for Biomed Devices. This is our manufacturing award in the face of COVID. And Dean, you were an essential manufacturer, one of the most manufacturers in the world over the last 4 months. Your product, ventilators, always a critical product, but I can't imagine the response that you've had over in Guilford just in the last 4 months.
Yeah, Garrett, thank you. We're happy to accept this award. It has been extremely busy over the last 3 months. Nothing like we've ever seen before. Getting calls from all over the world, not just the US, for our products. And it's been very difficult to source parts, and we've had our employees here working 7 days a week. So I'd like to dedicate this award to our employees for putting all the time and effort in that they have. As I said, it's been very difficult. We've had a lot of companies that have reached out to us to help us, very large companies that have worked with helping us source product, fine-tune our assembly lines. They don't want to be recognized, or I'd mention their names, but 4 very large companies, 2 in Connecticut, that have really stepped up to help us. And it's just, ventilators, no one really knew what ventilators were. If I was at a cocktail party 5 years ago and someone asked me what I did for work, manufacture ventilators, they'd think air handling systems. Now, unfortunately, because of this pandemic, everyone knows what a ventilator is. And it's a piece of equipment that you can't go out and find parts just off the shelf. These are specialized parts that we need to produce our products. And that's been the most difficult part and the most frustrating part for us, is that if we could get more parts, we can get more product out. And we're very limited. There's something called a DPAS rating, which we don't have, unfortunately, which is Defense Protection Act. We get more to the front of the line to be able to get some of these parts. And we're lobbying with the government to try to get that right now, because there's still a huge demand. But again, we appreciate this honor. And I just have to say, our employees have been fantastic throughout this whole thing.
We appreciate the work you've done. And as you were mentioning, I'm sure all of your supply chains were disrupted through the pandemic itself. And are we, just from where you sit, are we starting to catch up with having enough ventilators globally? We don't know where this virus is going to take us, so we obviously want to have a large supply as things continue to ramp up, or hopefully maybe quiet down, but we want to be ready. Where do you think we sit?
Well, we're starting to see some more parts flowing in. We've ramped up. We're ready to put a second shift on, but we can't do that till we have the parts to be able to handle that. One of our critical suppliers is in Minneapolis, and they were running 3 shifts. With the riots, 2 of the shifts got cut off. So, they're coming back on now. These are the things we're dealing with every day, as far as, making sure we can get the parts. We've got the labor to be able to do it, but it's really all about the parts right now.
Well, incredible work that you are doing at Biomed Devices. And as you mentioned, the entire team over there, we appreciate everything that you're doing to make this happen. So thank you again for being on with us.
Thank you, Garrett.
Now we're going to join in by Paul Bartosik with Harvard Pilgrim Healthcare. He's the outgoing chair of our Healthcare and Life Sciences Council, and Andy Orefici with Yale New Haven Health, our incoming chair. And Andy can turn on his video camera now and join us. It was great hearing from all of our honorees with the awards that we just went through. And now we want to talk a little bit about our Healthcare and Life Sciences Council. And Paul, you've been a part of the council for many years. Can you just tell us why have you been involved? What have you gained out of being a part of this council?
Well, I'm involved because I'm in the industry, currently working for Harvard Pilgrim Healthcare here in Connecticut. But beyond that, I really saw it as an opportunity to grow both personally and professionally, and that certainly proved true over the last 10 years or so.
Okay, and Andy, thank you so much for stepping up and taking on this role. And how can people get more involved in the council?
Thanks, Garrett. Best way is to begin to come to our councils and conversations, get-togethers that we have now via Zoom every other month. It used to be in person, of course. We hope to get back to that as soon as we can. It's a great way to interact with folks in both the health delivery and life sciences industries, as well as supporting organizations and industries really across those that the chamber serves.
And there are many members on the council, and so we want to recognize them. We also have some new members coming on board. Maybe just talk a little bit, if both of you want, just about how people can start to, if they want to get on the actual council, and the great events that we put on.
Well, I think as Andy said, come to the events. So obviously they're virtual for now, but very welcome. And if anybody watching today has an interest or knows of anybody in the organization that has an interest, please reach out to the chamber.
And Paul, we really want to thank you for being such a leader. You're on the board of directors for the chamber, a great supporter of the chamber. And Andy, I know you wanted to say a few words about Paul's leadership on the Healthcare and Life Sciences Council.
Oh, thanks, Garrett. Paul, I think we've both been on the council for about as long, at least 8 years. So we've seen a lot happen over the course of that time. You've been nothing but inspirational as far as a leader of the council the last 2 years. You have very humbly raised the bar, and there are very big shoes to fill. I appreciate your friendship over the last number of years. You've been an accidental mentor, and I appreciate it. I'm looking forward to working with our growing team to keep providing great content. And just a quick note, please let us know to all those chamber members, we're here to serve you, and we would love to keep providing content that's relevant, and that will keep you coming to the conversations and keep them growing. And again, Paul, thank you very, very much.
Yeah, Andy, thank you, and thank you to the chamber for having had the opportunity. It is bittersweet, but I'm really excited by the fact that this past year we did expand the scope of the council beyond just healthcare to include the very important industries of life sciences. So very excited, but a little bit of a bittersweet moment, and the council is in great hands with Andy Orphy.
Thanks, Paul.
Andy, we look forward to working with you. Paul, we're going to have you stay on the line for a moment because Harvard Pilgrim Healthcare was our presenting sponsor of our Chamber Wellness Challenge that we started this year.
Yeah, so thank you, Garrett. Harvard Pilgrim Healthcare and I are personally pleased to have been the sponsor of the inaugural Chamber Wellness Challenge. I do want to recognize both Eric Thompson of Blueback Health and Shayna Snyder of Fit Style by Shayna. They really took this from concept to completion. And it's especially important because the concept arose well before we knew about this pandemic. So the ability for them to shift so quickly and pivot to a virtual challenge, I think was just huge. And again, Harvard Pilgrim was very pleased to be a part of this year's challenge.
We thank you for your support of it. And let me welcome in Eric and Shayna, who you just mentioned. They're going to announce our awards, our winners from the Wellness Challenge. So Eric and Shayna, thank you very much.
Great. Can you hear me okay?
Yep.
Wonderful. So as a co-chair of the Chamber Wellness Challenge and a member of the Health and Life Sciences Council and the owner of Blueback Health here in Glastonbury, Connecticut, I want to just thank everyone that participated in our 90-day challenge. It was 3 years ago, we actually won the Wellness Award at the awards breakfast for our employer solution or option, Blue Chip. And so on behalf of my co-chair, Shayna Snyder, my Health and Life Science Council committee members, the over 40 teams and 200 participants that joined in for the last 90 days, Harvard Pilgrim is a sponsor, the chamber staff, and my team here at Blueback Health, it was a big success. We started talking about this 3 years ago, and without a doubt, we're seeing with our clients in the data that simple walking and health engagement is lowering health insurance costs and the need to consume care. So with that said, we had 15 teams that qualified for the grand prizes that Shayna is going to announce in a second. A few fun facts. We walked a total of just over 100 million steps over 90 days. 50% of the population walked at least the minimum of 450,000 steps. And then of the 15 teams that did qualify, their average step count over the 90 days was a million, which is over 10,000 steps a day. And then we had 4 people that walked over 2 million steps. So with that, we also featured a number of other things, but we were, without a doubt, our agenda was cut short because of COVID and the need to social distance. But overall, I think Shane and I are really happy with the results and felt it was a great success on this inaugural tour. So with that, I'm going to turn it over to my dynamic co-chair, Shayna Snyder of Fit Style by Shayna, to announce the winners.
Awesome. Thanks so much. So instead of the drum roll, I'm going to give us a little Fit Style tip. So I know we've been sitting for a little while, so I'm going to give you permission to stand up and do a little posture check. Shoulders back, abs are in, top of the head to the ceiling, because we can always bring fitness into everyday life, right? That just like this walking challenge. So with that, our $500 prize winner, this is the team, is Mary Wade Fitness Junkies. So that's Tiffany, Molly, Mallory, and Trevor. So give them a round of applause. Our $1,000 prize, these are getting bigger, you guys. This is the Spectrix Services Team, North Haven 2 team. Very exciting. And the big drum roll posture check, $1,500, is the Mary Wade Scrambled Legs team. Yes, love it. So big round of applause for them, maybe even a little shoulder roll, right, while we're here. So the prizes don't end. These were all the teams that won, that completed that 450,000 steps, but we have some individual prizes. These are for people who made that 450,000 mark, but the whole team didn't quite make it. So still individual prizes here. So the Neighborhood Music School prize goes to Christina Wong, very exciting. And Jack's Steakhouse prize goes to Maureen Carini. And last but not least, the Atelier Florian goes to Hung Lei Chow. So I know the Chamber will be reaching out to all of the teams and the winners to make sure these prizes get into your hands. So thanks so much for participating, and just remember that every step counts.
Thank you, Shayna, and Eric as well. You guys put so much time and effort, along with the rest of the Healthcare and Life Sciences Council, into this program and really made it a success. That's what happens at the Chamber. We have members who take on projects, work through the Chamber, and are able to create some really incredible things. So we appreciate everything that you did with this. We are near the end of our program. I know we're running just a little bit over, but we appreciate everyone hanging with us, hopefully for that grand prize. And I will bring that up again. Now, the key with the grand prize here is we need to have you know you are here. So once we have already randomly drawn names as the winners, but to actually make sure that you are here, you'll have to type into the chat and let us know you're here. Identify yourself, and then Tamika or Shantae will let me know that we actually have a winner for that prize. So that's how we're going to do this. Again, I also want to re-point everyone out to our program, our digital program that we sent out this morning. It has all of our honorees. We had such an incredible list of honorees for this morning. So our winner for the first package, this is the Madison package with the Homestead, Madison Beach Hotel, Cafe Allegra, and our first drawn name is Lisa Roy. So I will wait for Shantae and Tamika to let me know. Lisa, if you're out there, please let us know in the chat. Please verify that it's you, and we will be able to give you that award. I'm waiting to hear from Tamika here. And you know, this is a digital age now. I'm checking my cell phone to hear from Tamika, who's going to verify. All right, I heard from Shantae and Tamika. Lisa Roy is still on the line. Lisa, congratulations, and thank you again to all of our prize sponsors for the Madison Prize. So our Eat Local, Shop Local, Play Local prize number 2. This is New Haven centric, and it has lots of restaurants. Basta, Atelier Florian, LL Bean as a retail store. The Graduate New Haven, they're reopening on July 8th. We're so excited to have them back. Ben & Jerry's, and also the South Bay Restaurant. And the drawn name before we started is Shayna Ross. So Shayna, if you are out there, please jump on the chat. Let us know that you're there. Again, Tamika and Shantae will let me know that it's confirmed. So we are looking for Shayna Ross to confirm that she's still on the line for our second grand prize. I don't see the numbers moving on the chat, so we will give one more moment here before we move on to our next drawing name. Okay, I'll give it one more minute. It does not look like we still have Shayna Ross, so. All right, we will move on to the next name that was drawn for the second prize, and it's Jennifer Morgan Delmonico. So Jen, are you still on the line? If you are, type in the chat, let us know that you're here. So this is for the New Haven, Connecticut package. We are looking for Jen Morgan Delmonico. If Jen is still out there, type your name into the chat. We'll give Jen a moment. We did plan for this contingency that we would possibly have people who are no longer on the line. I will give Jen one more moment. Okay, and Jen is not here. So we are going to go to our third name, and it is Casey Creedon. Casey, are you still on the line? We are looking for Casey right now. This is for our second package. This is for the New Haven package. And I'll just, oh, okay, Casey is there. Casey is there. So we have our two winners. We didn't go deep into the list. Again, Lisa Roy won our first package, and Casey Creedon won our second package. This has been a full day, obviously, of bringing information to you. We want to let you know that we have several more events coming up. We've been able to provide a lot through this digital and virtual means. And so I want to let everyone know that Friday morning at 10 o'clock, it's Juneteenth, and we have a very special Diversity and Inclusion Council, Economic Diversity and Inclusion from Lip Service to Action. And you can see the esteemed panel of guests that we will have on with us. And then we are still having the rest of our events for this year, a few changes, and we're still working out what those events look like, but we did want to let you know September 1st, that's our Policy Summit and End of Summer Bash, still going forward. Thursday, September 24th, we've moved the regional real estate and construction forecast to that date. Again, the form will still be to be determined, but we want to put that on your calendar. And then we are combining our annual meeting and business leadership awards luncheon October 8th. You heard Marna say she will be there, and she will be our keynote speaker for that event. Many things to occur at that event. I really want to thank our entire staff. Thank everyone who attended today, all of our panelists and guests. And thank you to all of the heroes in business, in healthcare, life sciences, who are leading the fight against COVID-19. Thank you again for joining us, and have a great day.